Students, welcome back. Now we are going to see the lymphatic drainage of the lungs. The lymphatic drainage of the lungs are done by two sets of lymphatics, both of which drain into bronchopulmonary lymph nodes. So there are different kinds of lymph nodes which are associated around the lung, but the lymphatics or the lymphatics from the lungs are drained into finally bronchopulmonary lymph nodes. As we know that this bronchopulmonary lymph nodes are present near the hilum of each root of the lung. So these two sets are, one is the superficial set and another one is the deep set. So here you can see this bronchopulmonary lymph nodes and the lymphatic vessels. So inner side you'll have some yellow things. So those are the superficial as well as the deep set of lymphatic. Superficial vessels drain the peripheral lung tissue, so that means which are present superficial peripheral lung tissue lying beneath the pulmonary pleura, okay. These vessels pass around the borders of the lung. And also margins of each fissures, and also it enter into the margins of each fissure. These superficial vessels are present on those areas. These vessels will drain the lymph and finally it reaches to the bronchopulmonary lymph nodes. Okay, this is about the superficial set of lymph nodes. Superficial vessels drain the peripheral lung tissue lying beneath the pulmonary pleura, and these vessels pass round the borders. Of the lung and margins of fissures to reach the hilum. So this is about the superficial vessels. And coming to the deep lymphatics, these deep lymphatics drain the bronchial tree. So this bronchial tree which is present deeply, secondary bronchi and tertiary bronchi, and also the segmental bronchi. So from all these areas, these lymphatics drain from the bronchial tree, and also the pulmonary vessels and the connective tissue present in between the septae of each pulmonary segment. They run towards the hilum, so all these deep lymphatics finally run towards the hilum and pour it into or drain into the bronchopulmonary segment. The superficial vessels have numerous walls. All these vessels, inside the vessels it is having walls, but in the deep it has only few walls or sometimes no walls are present in the deep vessels. So normally the deep set and the superficial sets are connected very frequently through its course, but in the case of lungs, so there is no free anastomosis between the superficial and deep vessels. Only some connections exist which can open up so that lymph can flow from deep lymphatics to the superficial lymphatics and finally drains into the and finally reaches to the hilum, and in the hilum it is having a bronchopulmonary lymph nodes where it is drained finally. Okay, so because of these connections, the lymph from the deeper to the superficial lymphatics can pass. When the deep vessels are obstructed in disease of lungs and lymph nodes, if any disease to the lung or lymph nodes, the deep vessels are obstructed. So this is about the lymphatic drainage of the lungs. So the lymphatic drainage of the lungs are having two sets of lymphatics, both of which finally drain into the bronchopulmonary segments, bronchopulmonary lymph nodes. These will present in the hilum, okay, hilum of each lung. So one is the superficial set and the deep set. Superficial vessels drain the peripheral lung tissue lying beneath the pulmonary pleura. The vessels pass around the borders of the lung and also the margins of the fissures and finally reach to the hilum. Deep lymphatics drain the bronchial tree and pulmonary vessels and the connecting tissue and the connective tissue which are present in the septa. Okay, those deep lymphatics also run towards the hilum where they drain into the bronchopulmonary nodes finally. So this is, and also for superficial and deep vessels there is no free anastomosis, but it is having only few connections. With that few connections, the lymph from the deep lymphatics will drain into the superficial lymphatics. And in sometimes if any disease to the lungs and lymph nodes, the deep vessels are obstructed. So this is about the lymphatic drainage of the lungs. Thank you.